Hey, this is Dr. Frank from Walden Dental with another episode of Tooth Talk, to where we talk about all things healthcare related and not only about your teeth. I am so honored and privileged today to be able to have Dr. Mark Sweeney from Austin Dental Spa sitting with us. Dr. Sweeney has been a dentist in Austin for over 40 years. He has been an exceptional mentor. He has set the stage for what a customer's, and more specifically, a patient's experience in dentistry really ought to be. Dr. Sweeney, thank you so much for being here. You have been my mentor. You have been someone who's really helped me understand the evolution of dentistry, how to adapt all the time, how to be able to serve and exceed expectations for what patients not only need, but I think what they should really demand from us as providers. Tell me about when you decided to take on that next leap in getting into digital dentistry and same-day dentistry, as we have embraced here too as well.
Absolutely. It just kind of evolved, I wanted to stay at the forefront.
Yeah.
Sometimes it's not the best idea to be the early adopter.
Right.
And I've got a closet full of stuff just like you're probably developing.
Oh, yeah.
Of the first computers. I was the first dentist I knew to buy a computer in 1985. I bought my first IBM PC, and I remember at Businessland buying the thing on December 31st to get the tax credit for that year. And the guy that sold me the computer said, "Oh, Dr. Sweeney, that 10 megabyte hard drive, 10 megabyte, you had a choice of getting one with two floppy disk drives or a floppy disk and a hard drive. 10 megabytes. My phone has more than that now. And so, but he said, Dr. Sweeney, you'll never fill up that 10 megabyte hard drive.
We can't even send emails now.
1985, that was true. And the only thing it would do, it was basically a fancy Rolodex, but it would print bills. And at the time, I was paying one of my front desk people for a day and a half a month to type bills by hand every month, and that just seemed like such wasted effort. I'd rather have her answering phone calls or making outbound phone calls, but somebody had to send those bills out.
And that's the thing about being available, and so many patients have told us the challenge is making the call to the dental office and finding out that you're either on hold forever or you're incessantly leaving voicemails. And when you're going through a dental emergency, you don't have time to waste. It's even further disparaging. And then being able to now, in modern times, text messaging. We've had patients, especially during the COVID emergency, literally taking pictures of their face and immediately sending it over and saying, can you help me or can you fix this? I mean, the evolution that has evolved, and for those that haven't participated in it, it's almost shocking.
I have friends and employees that utilized telemedicine during this last 6 weeks because they didn't want to go to the doctor's office. And I don't blame them. Certainly wouldn't want to go to an emergency room. That's almost as fun as going to a Costco and touching everything in the store. The only people that are going to the ERs are sick people. So if I had a toothache, I don't want to go to some place where everybody else sitting out in the reception area thinks they've got this virus. So we stayed open throughout the whole thing, as I think you did, for emergency care, and we promoted that on our social media, that we are open if you've got an emergency need. Unfortunately, 42 years of being a dentist in town, we were able to see 3 or 4 people a day.
That same thing.
But they came in with their face swollen or with a broken tooth, or they were up all night with a toothache, and they were appreciative that we were available so that they didn't have to go to an emergency room.
And some of those patients and most of the patients that we had seen were new patients because they either didn't have a dentist of record or their dental office was closed. And some of our patients were sharing stories that they had to call 25 offices and just exhausted in that experience. And that makes, patient education, it's fantastic that we have some of that knowledge, but it has to be vetted. Because if it's not vetted and we're not using critical thinking, hysteria can be overwhelming.
Correct.
And getting back to the element of dentistry and having the ability to assess, or what more importantly, we've been unable to assess general health care because oftentimes these chronic illnesses, chronic inflammation, chronic hypertension, they're not painful. This isn't something that we can see, just like coronavirus. This is our invisible enemy that's going on inside us that is not getting that same level of attention. But we're required to take blood pressure on every appointment. We're required to do those vital assessments. We're able to see the status of what that inflammation's effect is on their body, how it can affect their cardiovascular system. When we see erosion on teeth, the implications of acid reflux, being able to screen for, if we let this alone long enough, can that affect not only their GI, their intestinal tract, getting into esophageal cancers, getting into other elements of sleep apnea, airway obstruction. We're on the forefront. And when we're not considered essential, I can only imagine all of these other undiagnosed conditions continuing to go on to where we'll overwhelm our healthcare system when coronavirus becomes yesterday's news and there's a new hysteria to come up.
We've been ahead of the rest of the world. We're the only profession that's trying to put ourselves out of business every day. We spend hours and hours each day educating our patients about how to not need us.
Exactly. And if it wasn't for Halloween, which is only one day of the year, I mean, otherwise, the simple things make up such big differences. And as you mentioned, dentistry, coronavirus, COVID-19, this isn't so scary for us because universal precautions, because of the intimate relationship that we have with patients, close proximities, everything about aerosols and getting into our mucosal openings in our eyes, our nose, our mouth, our throat. We have been so far ahead of that curve. Dentistry has already taken these measures as far as where people have been so afraid that healthcare hasn't. This isn't anything new for dentistry.
No.
We've been prepared long.
We've been on top of this since the AIDS epidemic.
Dr. Sweeney, thank you so much for all of your time. This has been incredible. I think it has helped so much for patients that are watching, or prospective patients. And you're accepting new patients too, correct?
Absolutely.
Yep. To be able to get a little bit more comfort of knowing not only are we going to be okay, but recognizing healthcare providers can also identify where we can help lead our patients in a more clear, a more safe, a more trusting way to help temper this fear that I think has been marketed in a way that some have made a little too much noise without understanding the consequences. So thank you again. I could probably roll this for the next 4 hours, but this has been wonderful. Dr. Mark Sweeney, please look him up at Austin Dental Spa, an exceptional dentist, someone who I look to for not only inspiration and guidance, but where I can carry my dental practice for the next 20 years to come. Take care, live well, stay safe still, and please smile.